Hi everyone, my name is Denise Salazar and this is my project on global health promotion. So in this scenario, there's a tsunami in Indonesia that has caused outbreaks of cholera as a result of contaminated water. A group of nurses are requested to be sent to the village to offer health promotion teaching regarding the outbreak of cholera. So first off, what is cholera? Cholera is an acute diarrheal infection caused by the ingestion of contaminated food or water. In the industrial world, and due to excellent sewage and sanitation systems that are in place, there hasn't been any cases of cholera that have been reported in the past several decades. However, in the developing world, this is a completely different story. Cholera remains a huge health problem whenever water and sanitation standards are compromised. In this case, we have a country's infrastructure that has been affected by a natural disaster, which is a tsunami, which has caused scarce clean water, which makes for the perfect breeding ground for cholera. So according to the World Health Organization, supports that cholera outbreaks cause panic, disrupt social and economic structure, and can impede the development in the affected communities. As far as assessing the learning needs of the community, the first step is to evaluate the community's existing knowledge on the topic. This can help frame the areas that need to be taught. Next, identify areas that need reinforcement is also key. This is important because it increases the wanted behaviors and the knowledge. Assessing the educational level is also very important. This increases and determines whether the audience is able to understand the material that's being presented. In addition to the points of assessing the educational level, identify the learning style is also equally important, whether it be visual, auditory, kinesthetic. It just helps promote the learning of the teachings. After reinforcing the old concepts and phrasing new ones, it is also important to assess whether the information has been retained. This can be achieved by seeking out demonstrations, putting teachings into practice, and looking for opportunities to teach others. Another way is also relating new material to what you already know. So the community model that was selected as a health promotion model is the Orem self-care model of nursing. This model is based on the philosophy that all patients wish to care for themselves. According to this model, patients can recover quicker and more holistically if they are allowed to perform their own self-care. So first off, what is self-care? It is a performance that individuals initiate on their behalf to maintain life, health, and well-being. When it is effectively performed, it helps maintain structural integrity and human functioning. Okay, this theory is comprised of three related parts shown on the screen. Whenever a patient is unable to meet their own self-care requisites, a deficit occurs. This model will help guide the development of my teaching plan because it will help teach the patient certain skills and information in order to perform self-care tasks. So as far as the health education plan, the main goal is that the members of the Indonesian village will not contract disease due to the contaminated water or experience an outbreak of cholera within the first month of health promotion teaching. Ways to implement this goal, the first one is the members of the village will demonstrate knowledge of disease prevention by being able to verbalize ways to prevent outbreak and disease by frequently washing hands, disposing of human waste properly, drinking and using safe, clean water. The second way is that members of the village will participate in disease surveillance by providing feedback to local authorities regarding the suspicion of outbreaks. So members are playing an active role in keeping tabs on any suspicion of the outbreaks. And lastly, members of the village will obtain the cholera vaccine to prophylactically prevent the spread of cholera outbreaks. So, some of the articles that I used for this project, the first one called Cholera Prevention and Control in Refugee Settings, it addresses the need for awareness campaigns during outbreaks and importance of providing information to the community. This kind of goes along with the surveillance campaigns. The next evidence-based practice article was called Cholera, Migration, and Global Health. In this article, it outlines the importance of preventing the spread of cholera outbreaks by obtaining the cholera vaccine. And lastly, a cholera outbreak caused by drinking contaminated river water. That was the article. And that article, it talked about also the surveillance. So countries affected by cholera, they're encouraged to strengthen disease surveillance and national preparedness to rapidly detect and respond to outbreaks. So not only is it the surveillance campaigns, but also being aware of what is it that causes cholera and also the symptoms that may arise when this happens so that we're able to rapidly detect it and respond to it. Okay, so an evaluation method, it assesses the effectiveness of teachings that can be achieved by asking questions on approaches for preventing the spread of cholera outbreaks. We can assess the outcome of health education plan by trending outbreaks of cholera from the start of the implementation of the health promotion to time of evaluation. So, in conclusion, the World Health Organization describes cholera as a disease of inequity, an ancient illness that today sickens and kills only the poorest and most vulnerable people. It truly is striking to see that the map of cholera shown in the background, it's essentially the same as a map of extreme poverty. So you see a correlation there. According to the World Health Organization website, cholera can be controlled with a multi-sectoral approach, which includes basic water, sanitation, and hygiene. In addition to that, the oral cholera vaccine. Moving forward, ways to further promote teaching plans that prevent outbreaks of cholera include early detection and rapid response to contain outbreaks. This can be achieved by promoting community engagement and patient readiness. As mentioned earlier, a multifactorial approach is key in tackling this potential deadly disease. This can be further implemented by enhancing readiness for cholera outbreaks by having resources in place for patient care and emergency interventions. It is important to enforce the big trio, which is water, sanitation, and hygiene to prevent cholera. And these are my references. Thank you.